Welcome to the Benefits Open Enrollment for the 2024 plan year. Open Enrollment happens once a year, and it is your opportunity to learn more about your benefits, make changes to your benefit elections, add or remove dependents, and enroll in new coverages. Your benefits will renew on January 1st. This is an active enrollment. You are required to enroll or waive benefits in Paylocity during the open enrollment period. Benefits are available to full-time employees and their dependents. We offer 4 medical plans through Meritain using an Aetna network of providers. If you enroll in our medical plan, you have access to our Teladoc telemedicine service. Our vision plan is with Superior Vision. Our dental, life, and disability coverages are with Sun Life, and our accident and critical illness plans are also offered through Sun Life. We offer medical care and dependent care flexible spending accounts administered by Basic. You and your family have access to an employee assistance program through Metropolitan Family Services at no cost to you. We offer orthopedic regenerative treatment in our medical plan through RegenX, which is a lower cost alternative to orthopedic surgery. Additionally, employees and their family members will continue to have access to our medical second opinion and concierge service through Pinnacle Care. ETM also offers a pet insurance policy with Nationwide and cyber and identity theft protection plans with Allstate. Over the next few minutes, we will review these coverages in more detail. Our benefits guide includes additional details about all of the benefits offered to you. Contact information for our insurance carriers and benefits consultants is also included in the guide. Be sure to review this guide before making your elections. All of our health plans cover in-network preventive care at 100%. No deductible or copay applies. This includes flu shots, annual physical exams, well woman, well man, and well child exams, including preventive labs and immunizations. Preventive mammograms, prostate exams, and colonoscopies are covered after you reach a certain age threshold. In addition to preventive exams, our HSA plans cover preventive medications for copays. The deductible does not apply. We encourage you to take advantage of our preventive care coverage and seek routine checkups. Teladoc allows you to have a virtual visit by phone or video with a licensed physician at any time from anywhere. You will discuss your symptoms, and the doctor can diagnose and treat a wide range of non-emergent medical conditions and even call in a prescription. Teladoc is especially convenient for those times you are unable to leave work, it's the weekend or after hours, you are traveling out of town, or your primary care doctor does not have any openings. When you consider that the cost of an urgent care or emergency room visit can be anywhere from $100 to a few $1,000s, using Teladoc can provide significant savings and convenience. We encourage you to register yourself and your dependents for the service online or through the mobile app in advance, so that when you need to request a visit, the registration process is already complete. Covered spouses and their children over age 18 must register themselves for their own Teladoc access. See your benefits guide for more details. The Bronze and Gold plan options are high deductible health plans. When enrolled in a high deductible plan, you pay the cost of non-preventive medical services and prescription drugs until you meet the calendar year deductible. The Bronze plan deductible is $3,500 per person with a $7,000 family maximum. After you meet the deductible, the plan will pay 70% of covered in-network services, and you will pay 30% until you meet the out-of-pocket maximum of $6,500 per person to a $13,000 family maximum. The Gold plan has a calendar year deductible of $2,000 for single coverage and $4,000 if you cover dependents. The full family deductible must be met before anyone in the family has co-insurance coverage. After you meet the deductible, prescription drugs will be subject to copays, and the plan will pay 80% and you pay 20% of covered in-network medical services until you meet your out-of-pocket maximum, which is $4,000 per person with a $8,000 family maximum. The out-of-pocket maximum includes the deductible, co-insurance, and prescription copays. After you've met your out-of-pocket maximum, the plan will pay 100% of in-network medical services for the remainder of the calendar year. Both plans also include out-of-network benefits. However, out-of-network services will be subject to a separate and higher deductible and out-of-pocket maximum. With our HSA plans, you pay the cost of medical services and non-preventive prescription drugs until the deductible is met. It is important for you to be a careful consumer of your healthcare benefits. You can save money by doing things such as using your primary care doctor or teledoc for non-emergent illnesses versus going to the ER. Using a standalone facility instead of a hospital for lab work, outpatient surgery, or a diagnostic scan such as X-ray or MRI can save you up to half the cost for these services. If you take a medication on the preventive medication list, you pay copays for these medications and the deductible does not apply. The Silver and Platinum plans are PPO copay plans. These plans offer copays for physician office visits, urgent care centers, emergency room visits, and prescription drugs. Under the Silver plan, medical services such as major diagnostic testing, inpatient hospital stays, and outpatient surgery are subject to a calendar year deductible of $2,500 per person, but no more than $5,000 per family. After you meet the deductible, the plan will pay 80% of covered in-network services that are not subject to copays, and you will pay 20% until you meet the out-of-pocket maximum of $6,500 per person to a $13,000 family maximum. Under the Platinum plan, the deductible is $3,000 per person, but no more than $6,000 per family. After you meet the deductible, the plan will pay 100% of covered in-network medical services that are not subject to copays, and you will continue to pay copays until you meet the out-of-pocket maximum of $5,000 per person to a $10,000 family maximum. The out-of-pocket maximum includes the deductible, coinsurance, and copays. After you meet your out-of-pocket maximum, the plan will pay 100% of in-network medical services for the remainder of the calendar year. Both PPO plans include out-of-network benefits. However, out-of-network services are subject to a separate and higher deductible and out-of-pocket maximum. When trying to decide which medical plan to enroll in, please consider the following things. How often do you use the doctor? And what are the typical services that you need? How much is the premium cost per pay period you are willing or able to pay? How much is the out-of-pocket maximum for the calendar year, and are you able to pay it in the event of a high-cost claim? Are you interested in the tax savings and the ability to save money for healthcare expenses by contributing to a health savings account? Thinking through these questions and weighing your options will help you make the best financial decision for you. Our pharmacy benefit is managed by TrueRx. Make sure you show your medical ID card to your pharmacy so that they process your prescriptions with the correct insurance coverage. TrueRx has an online member portal and mobile app that allows you to compare your medication costs at multiple pharmacies, view your claim history, view your ID card, and more. 90-day supply prescriptions can conveniently be filled at a retail pharmacy in addition to mail order delivered to your door, and you save money by only paying 2.5 retail copays for a 3-month supply of your medication. Our mail order program will be made available to you with WBRx Express. Get started transferring your current mail order prescriptions or start a new order by going to WBRxExpress.com and click Get Started. Prescription drugs are categorized into tiers. Tier 1 medications are generic, Tier 2 are preferred brand, and Tier 3 are non-preferred brand name medications. For covered specialty medications, you pay 20% of the cost up to a maximum of $150 for generic, $200 maximum for preferred brand, and $250 maximum for non-preferred brand. It is important to note that if you elect one of our HSA plans, copays for prescription drugs do not apply until you meet your annual deductible, with the exception of preventive medications, which are covered by copays immediately. We encourage you to use generic medications. These drugs cost you less and help us control the cost of our health plan. In many instances, you can obtain generic prescriptions for $4 or less at various local pharmacies by not showing your health insurance card. You can also obtain prescription coupons using the GoodRx mobile app or website that can significantly lower your cost for brand name medications. Any cost incurred when using a coupon will not apply to your medical plan out-of-pocket maximum. Our Maritime medical plans include coverage for Regenx. Regenx is an advanced regenerative treatment that helps to prevent the need for invasive orthopedic surgeries by using a patient's own natural healing agents to heal themselves with outpatient, minimally invasive injections. The cost for RegenX services apply to your medical plan deductible and coinsurance and are significantly less costly than an invasive surgery. Examples of conditions that may be treated with RegenX are arthritis, ligament sprain or tear, disc disorder in the spine, back pain, rotator cuff tear, and many more. To get started, speak to a RegenX patient liaison. See your benefits guide for more details. You and your family members have access to our health advisory and medical second opinion service called Pinnacle Care, powered by Health Navigator. There is no cost for you to utilize this service. If you or a family member is facing an unexpected healthcare challenge or diagnosis, Pinnacle Care is your resource for expert medical guidance. They will help identify the top medical experts and facilities for treatment, confirm your diagnosis and appropriate treatment options, organize and gather medical records to advise you on next steps, and help you schedule appointments at selected specialists. We hope that you will engage Pinnacle Care when you need medical care guidance, and you are able to feel a peace of mind that comes with your health advisor guiding you along the way. Our benefit program includes convenient online tools that help you track your benefits. Log into the Meritain website on your computer, phone, or tablet for access to your benefits, claims, and copies of explanation of benefits. You can also find a network doctor or hospital, compare treatment costs, and download a copy of your ID card. The most current provider information can be found online on the Meritain Health DocFind website. Please note, when looking for network providers, our health plans use the Aetna Choice POS2 Open Access Network. If you enroll in one of our HSA plans, you can contribute tax-free dollars to a health savings account at a bank of your choice. Funds in the account are used to pay for medical, dental, or vision expenses for you or your dependents, even if your dependents are not covered on the medical plan. You may also purchase over-the-counter medical supplies and medications with HSA funds. There are also investment options that can increase the value of your health savings account. Be sure to take advantage of this opportunity to save money for future medical expenses in your HSA. Please take note of the maximum amount that may be deposited to your health savings account in 2024. Keep all receipts for payments made from your HSA, as this is an IRS auditable account. Using your HSA to pay for ineligible expenses can result in a tax penalty. If you are over age 65 and covered by Medicare, TRICARE, or covered under another medical plan that is not an HSA qualified plan, including a flexible spending account through your or your spouse's employer, you are not eligible to contribute to a health savings account. Our voluntary worksite products are with Sun Life. Sun Life's accident plan pays benefits directly to you and helps you cover the cost of expenses associated with an accident, such as your medical plan deductible, coinsurance, and lost wages. Here are just a few of the benefits our accident plan provides. You can cover yourself and your dependents, and you can enroll for this coverage during open enrollment without having to complete a medical questionnaire. Sun Life's critical illness plan covers conditions such as heart attack, cancer, and stroke, just to name a few. Benefits are paid directly to you and can be used to help with a variety of expenses associated with a critical illness, such as travel, lost wages, or insurance costs. If you are not currently enrolled in this coverage, you can elect it during open enrollment. You can also increase your current coverage amount to a higher benefit amount during open enrollment. If you are enrolled in this plan and have had a covered preventive cancer screening, don't forget to file the wellness claim with Sun Life so you receive the $50 benefit. Our vision plan provides exceptional benefits at an affordable cost. If you use a network provider, you pay a $10 copay for a routine vision exam once every 12 months. Most lenses are available for a $25 copay once every 12 months. Once every 24 months, you can purchase frames, and the plan will cover the cost up to $130 after a $25 copay. If you choose contact lenses in lieu of glasses, the plan will cover the cost up to $130 after a $25 copay once every 12 months. If you use a non-network provider, you will file a claim to be reimbursed for your services based on Superior Vision's reimbursement schedule. The network includes retail options such as LensCrafters, Walmart, Costco, and VisionWorks, plus many others. You can also shop online while using your vision insurance through in-network online retailers, such as 1-800-CONTACTS, Glasses.com, or Contacts Direct. Superior Vision provides convenient online access to your benefits. By registering at superiorvision.com or downloading the mobile app, you may review your benefits, print or order a new ID card, and find network providers. Our dental plan with Sun Life covers services received from network and non-network dentists. Using network dentists allows you to receive the highest level of benefit and save on out-of-pocket costs. Charges from out-of-network dentists may be higher than the Sun Life's contracted fees, and non-network dentists may balance bill you for the amounts not paid by insurance. For this reason, we encourage you to use network providers as much as possible. To find a local network dentist, go to www.sunlife.com/find-a-dentist and choose the Sun Life Dental Network and select Go to complete your search. When using a network dentist, the plan covers preventive services at 100%. Cleanings are covered once every 6 months. Basic services such as fillings, periodontal maintenance, and simple extractions are covered at 100% after the deductible, and major services such as crowns, bridges, and dentures are covered at 60% after you pay the deductible. The annual maximum benefit amount is $2,000 per covered person per calendar year. Orthodontia coverage for children up to age 26 is covered at 50% to a maximum lifetime benefit per child of $1,500. The calendar year deductible for basic and major services is $50 per person to a family maximum of $150. Sun Life does not mail dental ID cards, but the good news is your provider can still see you without a card. Tell them you are a Sun Life member and provide your Social Security number. You still have the option to view or print your ID card by logging into the Sun Life portal or downloading the mobile app. Our dental plan with Sun Life includes a preventive max waiver, which means your preventive services do not count towards your $2,000 annual benefit maximum. Sun Life provides convenient online access to your benefits. By logging into their website or when using the Sun Life mobile app, you may review your benefits, check the status of a claim, and download copies of your explanation of benefits, find network providers, and view your ID card. ETM provides all benefit-eligible employees with base life and accidental death and dismemberment insurance with Sun Life in the amount of $50,000 at no cost to you. The benefit reduces starting at age 70. Be sure to review and update your beneficiary information when enrolling online. You may purchase additional voluntary life insurance through Sun Life for very low group rates on yourself in $10,000 increments not to exceed $500,000 or 5 times your salary, whichever is less. You may purchase life insurance on your spouse in $5,000 increments not to exceed 50% of the amount you elect on yourself or $150,000, whichever is less. You may purchase $10,000 life insurance on your dependent children not to exceed 50% of the coverage amount for yourself. During open enrollment, you can add new coverage or increase your current coverage. You will need to submit an evidence of insurability form to Sun Life and be approved for new or additional coverage on yourself or your spouse. EOI is not required for new coverage on your children. Be sure to review and update your beneficiary information when enrolling online. ETM provides employees with short-term disability coverage at no cost. This coverage protects your income in the event an accident or illness prevents you from working. The short-term disability pays you 70% of your earnings not to exceed $2,000 per week. Benefits begin on the 15th day of disability and may continue while you are disabled until long-term disability coverage begins. The short-term disability plan does not cover work-related accidents or injuries, but it does cover approved leaves due to childbirth. There is no pre-existing condition limitation. ETM also provides long-term disability at no cost to you. If you are still disabled and unable to work at the end of 120 days, the long-term disability insurance will pay a monthly benefit of 60% of your income to a maximum monthly benefit that is based on your job classification. Benefit payments for an approved claim begin on the 121st day of disability. You may continue to receive benefits for as long as you remain disabled and unable to perform your occupation, or until you reach Social Security retirement age. There is a pre-existing limitation on this coverage. Benefits will not be payable for any condition that exists within 3 months prior to your coverage effective date until you've been covered under the plan for 12 months. You and your family members have access to our Employee Assistance Program with Metropolitan Family Services. Our EAP is a free and confidential service provided to you at any time to help you maintain a healthy, balanced work and personal life. Whether you need assistance with life challenges such as relationship issues, coping with aging parents, or dealing with financial, legal, or emotional concerns, our EAP is staffed with fully licensed and caring professionals to ensure you find a resolution. The EAP includes 3 in-person counseling sessions at no cost, per member, per problem, per year. The EAP will work with your insurance to help you find a local counselor that accepts your medical insurance if you continue your visits. The EAP can be reached 24 hours a day, 7 days a week. Contact information for this service is provided in your benefits guide. Our flexible spending accounts are administered by Basic and provide the option to enroll in 2 accounts, a medical care account and a dependent care account. The medical care FSA allows you to make pre-tax payroll contributions to pay for medical, over-the-counter medications and supplies, dental and vision expenses for you and your dependents. Your annual contribution will be deducted from your pay, tax-free, in equal amounts throughout the year, yet you will have access to your entire election amount on January 1st. Once you make your election, you cannot change it until next annual enrollment, unless you have a change in family status. The maximum amount you can contribute into your medical care account is $3,200. If you are enrolled in one of the HSA medical plans and contribute to a health savings account, you cannot also contribute to a medical care FSA. You can, however, contribute to a limited purpose FSA that applies only to dental and vision expenses. You will have a grace period of 2.5 months after the end of the year to spend your FSA funds. Any unused funds after March 15th will be forfeited. Please check your balances now to make sure you do not lose any money in your flexible spending account. The Dependent Care FSA allows you to set aside tax-free dollars to cover daycare expenses for children under the age of 13 or for a disabled dependent of any age so that you can work. Funds in the Dependent Care FSA can only be used as they are deposited each pay period. We encourage you to review your personal tax situation, as you cannot use both the Dependent Care FSA and the Dependent Care Child Tax Credit when filing your personal income taxes. Please take note of the annual maximum amount you can contribute to your Dependent Care FSA. Documentation for proof of your qualified FSA expenses may be required by Basic. We offer pet insurance with Nationwide with preferred company pricing, and the cost is payroll deducted from your paycheck. The plan has a $250 annual deductible that must be met before the plan begins paying benefits. You can receive up to $7,500 in annual benefits. You choose a reimbursement level of 50% or 70% for services such as accidents and injuries, illness, surgery, x-rays, and so on. To use your pet insurance plan, visit any vet of your choice, pay for your services up front, then submit a claim to Nationwide for reimbursement of eligible expenses. To enroll in this benefit, go to benefits.petinsurance.com/ETMINC to enroll directly with Nationwide, or you can call Nationwide to sign up at 877-738-7874. You will receive a welcome kit from Nationwide with your policy and rate information, claim filing instructions, and contact information for Nationwide. We offer an identity theft protection plan as well as a second identity theft plan option that also includes protection from cyber risks. The Identity Protection Pro Plus allows you to catch fraud at its earliest signs with comprehensive identity, financial, and credit monitoring. The Pro Plus helps fend off scams with robocall and ad blockers, provides social media monitoring for account takeovers, and gives you access to full-service resolution support if a fraud incident does occur. The Identity Protection Pro Plus Cyber gives you all the features of Pro Plus, but also includes added cyber protection designed to help you defend yourself from today's cyber risks. Pro Plus Cyber includes tools to protect against viruses, phishing attacks, and malware on up to 5 mobile devices, personal computer, and network security, as well as ransomware expense reimbursement. When you sign up for the family plan, the plan you choose will protect the family members under your roof, as well as parents, grandparents, and in-laws that are over age 65. See your benefits guide for more details. You will enroll for your benefits using our Paylocity online enrollment system. Log into the portal and click on the Web Pay tab and select Web Benefits from the drop-down. Click Manage My Benefits, then select the Start button. The system will guide you through adding your family members and selecting plans. When you are finished, review the enrollment summary for accuracy before selecting Submit to complete your enrollment. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the benefits guide. If you elect a coverage that requires an evidence of insurability form, complete the online EOI as soon as possible at the website shown here, using policy number 942981 for voluntary life. Remember to use the tools available to you from Meritain, Teladoc, Metro EAP, Sun Life, and Superior Vision. Utilize in-network providers for our health, dental, and vision insurance plans to maximize your benefits. Let us know if you have any questions, and thank you for your time.